Hello, everyone, and welcome. I'm Kimberly Mazik with Georgetown's, the Associate Director for Georgetown's Initiative on Catholic Social Thought and Public Life. We're so grateful to have so many of you joining us today, with over 1,500 people registered in advance of our conversation on the human cost of abandoning U.S. help around the world, the experience of Catholic sisters and Catholic relief services. As we begin, I want to remind everyone that today, March 13th, is the 12th anniversary of the pontificate of Pope Francis. Since his election, he's always asked people to pray for him. So today we pray in a special way for his continued improvement of his health and in gratitude for his leadership for our church and our world. We hope you will join us in Dahlgren Chapel here at Georgetown or online next week as we mark 12 years of Pope Francis's leadership. That will be on Wednesday, March 19th for a Dahlgren Dialogue in partnership with Georgetown's Office of Mission and Ministry on the Francis Factor, the leadership of the world's pastor. In Fratelli Tutti, section 186, Pope Francis writes about a commanded love, expressed in those acts of charity that spur people to create more sound institutions, more just regulations, more supportive structures. It follows that it is an equally indispensable act of love to strive to organize and structure society so that one's neighbor will not find himself in poverty. It is an act of charity to assist someone suffering, but it is also an act of charity, even if we do not know that person, to work to change the social conditions that caused his or her suffering. If someone helps an elderly person cross a river, that's a fine act of charity. The politician, on the other hand, builds a bridge, and that too is an act of charity. We are so pleased to hold this conversation during Catholic Sisters Week, where we lift up the voices and witness of women religious living the gospel call every day. Catholic sisters are forces of faith and love who lead with compassion, tenderness, and tenacity. They help provide an example for all of us. In recent weeks, the Trump administration's reckless efforts to halt funding and dismantle the United States' capacity to provide food for the hungry, healthcare for the sick, and hope for the poorest on earth are destroying the lives and dignity of millions of our sisters and brothers around the world. Earlier this week, though, a federal judge ruled that the Trump administration must pay the nearly $2 billion that is owed to grant recipients and contractors for any work completed before February 13th. On Monday, Secretary Rubio also announced that 83% of U.S. foreign aid contracts are canceled, with the remaining 1,000 or so contracts to be administered by the State Department, which absorbed the United States USAID, the Agency for International Development. But today we have a great opportunity to focus on human consequences and the moral implications of this abandonment of our nation's traditional commitment to the poor around the world. To do that, we have a remarkable group of leaders gathered here to discuss their work to serve the most vulnerable members of our global community and human cost and moral consequences for the United States to be diminishing our commitment to offer food, healthcare, and hope to some of the poorest on earth. We have Sister Annalise Shambali. She's a member of the Servants of Blessed Virgin Mary of Blantyre, Malawi, and a senior program officer for the All African Conference Sister to Sister. She serves also on the board of directors for Catholic Relief Services. We have Sister Florence Muia, a member of the Sisters of the Assumption of the Blessed Virgin Mary of Nairobi, and the founder of Upendo Village, a ministry in Naivasha, Kenya, which is designed to support people living with HIV and low communities near Nairobi. We have Bill O'Keefe, the Executive Vice President for Mission and Mobilization at Catholic Relief Services. We oversee CRS's efforts to change U.S. foreign policy in ways that promote justice and reduce poverty overseas. He joined CRS in 1987, working in Tanzania. And finally, we have Sister Dee Smith, a Maryknoll sister and one of the founders of Proyecto Vida, a HIV/AIDS education, prevention, and treatment effort in Guatemala. She also leads the Hospice Care, which is a project of Proyecto Vida. Her interest and concerns about people living with HIV developed when she lived in Kenya. Once again, thanks to all of you who are joining us on the live stream. Please share your thoughts on social media and use the hashtag Catholic Global Aid GU or Like a Catholic Sister, and by tagging the initiative at GUCST Public Life. We'll have an opportunity for questions and answers later on, so please submit your questions by following the prompts at the bottom of your screen. And this dialogue is being recorded and will be posted on our website and social channels for later viewing. So let's start this conversation so we get to hear from everyone. I'll ask each one of you in turn a question. So Sister Endless, I want to start with you. What's your primary concern as the United States fundamentally changes its commitment to the poor and vulnerable around the world? What are those changes you'll see for children, families, and communities?
It's unfortunate to hear this because it has created panic and anxiety and fears around the globe. But also, I'm looking at the Catholic sisters that we do this because we love our mission, driven by our charisms. We have been doing this with or without aid, but we are looking at children under 5, and we are looking at mothers in various countries. And we're looking at uncertainties that is happening around the globe that is triggered either by war, natural disasters. That every time and then there is need for someone to support the other. Considering that life is sacred, need to be nurtured. I've been in touch with the different sisters across the globe, and most especially the sisters that I work with in the continent. Everyone is afraid to go back to where we were around the year 2000, 2005, 2010, during the peak of HIV and AIDS. However, the sisters around 2015, we have been discussing among ourselves to say, what is it that we can do when there's no aid? What kind of structures do we need to put in place if anything happens, as if we knew that we are going to reach to this stage today? This time which we are in gives us an opportunity to do self-introspections based on our knowledge and skills, and also intensifying our missions. We need to save the lives. We need to protect the vulnerable. We need to protect even ourselves. And most of our sisters that we are working with in the continent, they're in the remotest areas, and they're the only source of healthcare, education, and hope. We have been having partners like Catholic Relief Services that we have been working with in the continent in early childhood development to protect the children in issues of immunization and to take care of the first 1,000 days. What do? We pay attention to nutrition. We pay attention to their education. We pay attention to their health. Then, what kind of skills have we learned that we can use today? We have been discussing the importance of sustaining the missions that we do by integrating business strategies and also finding the resources locally.
Sure.
So we are here, we are taking this as an opportunity and to review and to rewind what would be the best thing for us to respond to this. The sisters out there, I think my colleagues also confirm to say, we do our work not only because of money, just because we love what we do.
Great. Thank you, Sister Endless. Dee, I come to you. What's your primary concern as the United States fundamentally changes its commitment to the poor and the vulnerable around the world? And you have to unmute yourself, Dee.
Sorry. My enthusiasm to answer. I think the people of the USA were there at the beginning of the HIV epidemic, working hard, first in California, on the East Coast, then spreading out to the rest of the USA and over to Africa and the rest of the planet. There were people of all shapes and sizes, colors and races joined together to fight a crippling disease, and they won the respect of the world for their efforts. The people of the USA who I know have not changed their commitment to the poor and vulnerable. It's the present government administration who has thrown over the marginated and the disenfranchised. Children, families, and communities here in Guatemala are and will be affected more and more by this administration's decisions around foreign assistance. Guatemala has the second highest level of malnutrition in children under 5 years old in the whole of Latin America and the Caribbean. That will get worse. Communities with restricted access to reliable health services and accessible road networks will miss clinical appointments and follow-up. And the mass deportation of migrants will put more pressure on the system here. That's what I'm seeing.
Thank you, Dee. Sister Florence, I come to you next. What's your primary concern as the United States changes its commitment to the poor and the vulnerable around the world?
Okay, my primary concern is the loss of the gains we have made for the last 42 years since AIDS pandemic. And Kenya, we are halfway that period. The whole world, we are talking of 25 million people living with HIV and AIDS. Out of that number, Kenya hosts 1.4 million. As I pronounce the number, it sends chills in my body because without the availability of the antiretroviral medications, which are life-saving, it threatens the lives of all these people. We are going to lose all the benefits we have gained over the years in prevention because by withdrawing funding, it may mean that even there is no money to diagnose new diagnoses, meaning we are going to have lots of transmissions, mother-to-child transmissions. We are going to see a lot of drug resistance with the laboratories not being able to function for lack of funding, where, blood was being sent for more investigations to see if these people are responding to the antiretroviral therapy or whether the regimens needs to be changed. With the closure of those facilities and the sending home of all the staff who have been doing the work of ensuring there is adherence, we are going to see a decline and defaulting by the people who are already so vulnerable. They are struggling in so many ways because it seems to have hit also so much among the poor people and the vulnerable. We can't deny that fact. And therefore, my concern is that we are likely to see a lot of spread of the disease again without prevention measures. We are also going to see probably a lot of deaths if no interventions are put in place, treatment failure, and the viral loads going up because without the laboratories to carry out the researches and the investigations needed to fight this war, we are going to be losing. So my fear is that we have gained so much, and unless the decision is reversed, we are likely to lose all that and continue losing more lives.
Thank you, Sister Florence. And Bill, I come to you. You've been doing this work all of you have been doing this work for many, many years. What's your primary concern as the United States fundamentally changes its commitment to the poor and the vulnerable?
Thanks, Kim. Great question, and it's humbling to be with these sisters doing such great work on the ground. Maybe I'll step back a little bit and take a wider view, which is my concern is needs are going up around the world thanks to conflict, thanks to climate-driven changes in the weather and in agriculture. Hunger, which for decades had been going down, in the last couple of years, the last 5 years or so, has been going back up. There are 733 million malnourished people around the world right now. And so you have a situation where needs are going up and the responses of governments are going down. It's not just our own government, actually. Governments in the UK and Germany and the Netherlands and other places have been cutting their development and humanitarian budgets. And I think that the sum of that is just going to mean more suffering and death for innocent people, and suffering and death that is frankly preventable. And so when the US leads, other countries follow. I agree with what Sister Dee said, which is that the American people themselves are not suffering from the globalization of indifference that Pope Francis talked about in 2013. But we need to make sure that we push our elected officials to step back up, to fill this gap, and ensure that we as a country are doing everything we can to meet the rising human needs.
Thank you, Bill. Sister Endless, I want to come back to you. You mentioned some of those sisters that you work with across Africa, and I know that you work with many sisters, not just in Malawi, but in other countries across East and Central Africa. What are you hearing from them about the impact of the cuts to U.S. funding, especially those working with in early childhood development? What are these cuts? What are these cuts? What are they saying about these cuts to life-saving programs and ministries in Africa?
Fear about especially immunization to children. Most of the countries that we're working with, the health system is not functional without support. And if we want it to function, it needs to be cushioned. And this has been happening for many years. And today, as I'm talking, children are being born every day. Okay? Then we are in the stop order work. What is happening to those drugs, those immunizations that are supposed to be facilitated to this kids? First, it's a waste of resource. And also, we should be thinking of those innocent mothers, especially most of the parts in the continent where there are other mothers, they can't manage to take this child to a private hospital where they can pay for this immunization. What are we talking about? Do you want all these kids to die? So this is what the sisters are talking about. Are they ready to see this happening? No. It's a situation that is creating a lot of fear. And the sisters are saying, we are not ready to go back to where we were. When All Africa Conference Sister to Sister was starting, it was around the years 2002, when HIV and AIDS was at the peak. You have to consider that time in the continent, especially in Africa, where many people died, leaving these innocent children, orphans, and we saw the boom of many orphanages. And today, we are saying we need to take care of these children in the families. And the efforts that has been done to build these families, we are here today dismantling them. What are we talking about?
Right, right. And what do you as a network of sisters do to support each other in terms of responding to this fear?
Of course, there's a lot of collaboration and a lot of discussion, especially on the looking at alternatives. Who can be the other partners that we can work with? I can say loudly here, when I was working with the sisters, and today I continue talking with the sisters about how can we sustain our function programs, especially the life-saving programs. What kind of new partners do we need to develop? What skills do we have as sisters that we can use? And what are the things that we can do ourselves without relying on aid? But the biggest concern is we can do almost everything, but when it comes like to health, it's very complicated because we don't have the machinery for ourselves to produce vaccine. Okay, we can give the vaccine, but we can't produce it. So if the vaccine is being produced maybe here in the US, and we're relying on other partners to transport this particular vaccine to the continent, and there's no support or cushion to do that, what are we expecting? We are suffocating the effort. We are suffocating the work that the sisters are supposed to do. We are suffocating the sisters to save the life that is sacred. So that's my biggest concern.
Sure, sure. I understand. Thank you, Sister Endless. Sister D, you're a Maryknoll sister. You've lived and worked in Guatemala for more than 30 years. And during this time, your focus has been your work with HIV. You've worked on HIV when little was known, or that, people were very fearful. And you helped start a task force in Maryknoll that helped train the Maryknoll community of sisters, priests, brothers, and missioners about HIV prevention, care, and counseling. And those many years of work, you've seen the situation change from caring for those with HIV in their suffering to providing antiretroviral medication, which allows people to live active lives with near normal life expectancy. How has the U.S. supported HIV efforts? You talked a little about that in the introduction, but what are the most serious concerns you have about the recent cuts to U.S. foreign assistance? And what are the immediate impacts for those living with HIV? You're on mute again, Sister D.
Thank you, Kim. Yeah, I'll get used to it by the time it's all over. Well, when I first started to work in Guatemala in 1994, I was part of an initiative of the National Health Commission of the Bishops' Conference of Guatemala to provide free HIV testing to people who had been diagnosed with TB and other risk factors related to HIV. As Bill knows, also CRS was very much involved with this commission. I was also involved in parish education and youth group outreach to spread the word of HIV, especially because there was so much ignorance around it. Very few international organizations were working in areas outside of Guatemala City at this time, and the level of understanding of HIV was very low, especially among rural communities. But during those first few years, we had very little help, and it was only at the beginning of 2000 when Proyecto Vida, our community outreach program, started to coordinate with Doctors Without Borders and the Guatemala Health Ministry for the establishment of the first HIV clinic outside of Guatemala City, that USAID started to reach out to us and push forward with their support. During the early days of the advocacy and lobbying of the government for antiretroviral treatments and to push laws to prevent discrimination and stigma and protect people and families with HIV, the US government, through USAID, was at the forefront of this struggle, especially trying to offer universal free treatment in Guatemala. They brought many projects to assist in reducing nutritional poverty in families with HIV. They helped the health ministry with hundreds of doctors trained to be specialists in HIV attention and care. And they were one of the first organizations, with the help of UNAID and the World Health Organization, to promote the well-being of the transgender community and the marginalized people of the rural communities. They facilitated the purchasing of antiretroviral medicines and encouraged us all to research and document our efforts to slow down the rate of infection in the country. During the period between 2010 and the end of COVID, we witnessed a slowing down of the rate of infections. Unfortunately, with the fragility of our health system, we're now seeing the effects of the withdrawal of USAID support as more new infections. Our resident population in the hospice has grown. 2 weeks ago, we only had 6 people in our hospice facility, 24-hour care. We now have 11. In other words, doubled in just 2 weeks. So really, those are the things that I'm very, very much concerned about. And I'm also, in some ways, it's quite interesting with what Florence and Ennis, especially Florence, shared in Kenya, the similarities across the globe of the effects of this kind of withdrawal of very vital funding for services which we depend upon so much.
Sure, Dee. You talked a lot about making sure people had access to antiretrovirals, and although those who've been following the HIV and in the trend, I remember when people used to say AIDS, they didn't even say HIV, but we've learned that it's a virus that can be contained with antiretrovirals. So what's the impact? I want people to help people understand the impact of people who are receiving antiretrovirals. Help us understand what it means if those drugs are discontinued.
Well, I think it's really important, Kimberly, to know that the US has worked side by side with the Guatemalan government health programs for many years. And I've witnessed firsthand how the technical and professional support of the expertise of the US has helped to strengthen the services, especially the 16 HIV clinics that we have now operating around the whole of Guatemala. Yet within days of the announcement of funding cuts, I know personally of 14 people who have lost their jobs in the 2 HIV hospitals we use, and they no longer offer vital services such as laboratory testing, which Florence mentioned, to evaluate the efficiency of the treatments. Routine exams are taking longer to schedule, and the results are delayed. Another big concern for me is the lack of support for the rural communities affected by HIV. The high level of poverty in these areas means many people with HIV have difficulty raising the money to go to the clinic to collect their medicines. With transport so expensive, the choice sometimes comes down to feeding their children or selling a chicken to pay for the bus to go to the clinic. And we know as women, and Bill, we know if a woman has to choose between feeding her children and going to pick up medicines, we know what she'll choose. Often community outreach workers using motorcycles in our area deliver the medicine to the health centres in the villages, and from there community nurses visit the houses and give out the medicine and instruct the people about protecting themselves and adhering to their treatments. Many of these community outreach workers were contracted by NGOs receiving financial support from USAID. Those organizations are now struggling to keep staff and raise money for salaries. So the knock-on effect is being felt throughout. Okay.
Just the numbers that you're mentioning in such a short period of time, you just take that out by weeks or months and know that would mean a whole lot more people. And those are family heads of households and people who are taking care of their young children. Sister Florence,
sorry, Kim, could I just add one thing? Sure. And that is that even if all the aid came back tomorrow, the immediate effects now are going to take quite a while to rectify as well. Re-establishing what we've already lost within the last month is going to take months, even if it changed, which I don't think it will either.
I hear you. And those structures are extremely important. Sister Florence, I want to come to you. And in 2003, so this has been over 20 years, you established a Pendo Village just northeast west of Nairobi. It's a modern facility designed to support people living with HIV. And we know that that's received support from the that there's been a lot of support in your country for HIV. You talked about the numbers earlier. And we know that some organizations will continue to at least receive payments for services provided up through the middle of February. But even though those payments have been received, what are your concerns about the future of those programs in Kenya and your program in particular?
Okay, thank you so much for that question, Kimberly. One of the concerns is the fact that when people realize there is no help, they will not even want to go and have what we call voluntary testing and the counseling. People are going, because like when we started with HIV in those early years, like in Kenya, the antiretroviral medications came in 2003. People were so scared about, about talking about HIV and AIDS. People were so scared to go and test because it was like a death sentence. And this seems like where we are reverting to. My fear is that like right now there was a waiver that was given. That waiver, we are not sure. It talks of, healthcare treatment. We are not sure whether it is still going to continue funding ARTs or if it will, for how long is the US government going to be committed? My fear again is we are going to see another phase of orphaned children that had already stopped because of their parents living long. And one of the reasons, for me getting involved in this ministry was to help mothers and fathers prolong their lives so that they can raise their own children. The best gift you can give a child is their parents, not anybody else to take care of them. And that is what motivated me. Anything I could do to see these parents live longer, to raise their children, I wanted to do it, and I've been doing it. Right. So my fear, as I said from the beginning, is us losing all those gains. These mothers are very vulnerable also to issues like cervical cancer, which has been also funded with the same funding where mothers could be screened. What are we doing to these mothers? Do we realize we are a global village where we need each other? US needs Africa. Remember, there are a lot of raw materials US is getting from Africa. When the population is down, dying, is it not going to impact them? Yeah, it's going to impact them because we are going to lose workforce, right? A healthy nation that can be able to work and provide for these raw materials that are needed to make other things. So Africa is not just a consumer. Let's not be looked at like as if we are just here consuming. We also provide in one way or the other. Right. And so we should realize we are a global village. What is happening in Africa soon will impact USA. So yes, let us think globally and act globally. Right, right. We're one human family, and we have to act together. Sister Florence, this might be maybe an easier question, but how has your faith guided and sustained you in this work? You've been doing it for a while, and as you talk about making sure that parents would live longer so they can take care of your children. So we have a sense of what guided you to this work, but how does your faith guide and sustain you in this work? One of the things I believe this ministry belongs to God. I'm only an instrument being used by God himself to reach his own people. And therefore, at this moment of uncertainty, I still believe and trust in this God who provides. And I know a change of heart can happen because God can reach where words cannot reach, can change the hardest hearts, which cannot listen to any human voice. And therefore, I live each day with the hope that we are going to, to sail through this storm. We are going to weather it through, and we are going still to survive. We are going to move on, regardless of the difficulties we may face. God is still steering the ship to the shore.
Amen. Amen.
Amen.
Thank you, Sister Florence. Just before I turn to Bill, I want to remind the audience that you be sure to email us your questions. There are instructions at the bottom of the screen on how to do so. So if you have questions for any of our participants in this dialogue, that would be great. Bill, you and I have known each other from my days at CRS. But I turn to you now. You've been with CRS for 35 years, living overseas and managing the development of CRS policies on U.S. foreign assistance and agricultural trade policy. And you've directed efforts to help promote justice and reduce poverty overseas. You've also tried to engage U.S. Catholics in this work and helping them to be advocates for those who are part of this human family that Sister Florence so beautifully spoke about. And yet we also know that Americans believe that our foreign aid budget is in the range of 25%. But in reality, according to Pew Research, we know that even since just fiscal year 2001, foreign aid has ranged from a mere 0.7%, so less than 1%, to only 1.4% of the total federal budget. So what we're talking about is a very small part of our budget, yet it does all this amazing work that all of you are a part of. Bill, can you give us an overview of CRS's work and how the administration's actions are affecting CRS's ability to serve those most in need and the poorest places around the earth?
Great, absolutely. So first, the good news is 45% or so of CRS's work is not supported by the U.S. government. And so I just want to say CRS is going to continue and will continue to grow and thrive as an institution, supporting sisters like the wonderful guests we have here today and the church throughout the world. But 55% of our assistance is from the U.S. government right now. About half of that is from the USAID, and a significant portion of that has been what's cut. And some of it is from the U.S. Department of Agriculture, and so far that seems to be going along without interruption, although, it's a little too early to tell if that will continue. I thought I'd give the example of Haiti, though, where that you can really sort of see the impacts of these U.S. government cuts, and also where I think many of us in the United States are familiar with Haiti and have relationships there, and so it might be helpful. We have 4 major U.S. government-funded projects in Haiti. 2 of them have been terminated. One has been suspended, which means we can't continue it, and it's waiting for their review. We don't know what's going to happen. And one was terminated and then rescinded, which basically means unterminated. We're still waiting for resources, actual cash, for the one that's been rescinded. So we can't actually implement the activities because we don't have the resources. But the impact of this is there's 70,000 people who are going to struggle to feed themselves pretty much immediately. Haiti, as you know, is a country that has a very serious malnutrition problem that is both endemic and also aggravated by the gang-driven conflict right now. And it's just really sad that people who have been getting assistance are going to lose it and struggle to feed themselves. 18,000 children who have benefited from the support to attend school, to learn, and then to thrive through that education may lose that education. And 21,000 children under the age of 5 will lose support for malnutrition support, additional nutrition to keep them healthy and to keep their mothers healthy so that the family can thrive and those kids can thrive in that family. I know Sister Annalise mentioned the first 1,000 days, and probably our audience is aware, but I'll just state that those first 1,000 days from conception to the second birthday are just critical for really kind of setting the life course of each of us. If you're seriously malnourished in that period, you can end up with permanent limits to your cognitive and physical abilities, and it's completely preventable. It's inexcusable that it happens at all, honestly, and particularly in this modern world. So that gives you a sense of, I mean, there's also some food assistance that we've are trying to place an order for that the U.S. government is supporting, and that's been blocked. And that is supposed to arrive during the lean season. And this is specially targeted. Again, Haiti, like many countries, is agriculturally based, and there's a lean season where people need some extra support, and they may not get it. And so I think that gives you a sense of kind of how, using Haiti as an example, throughout many countries around the world, women, children, and then men as well, of course, will face serious issues, physical and other issues, as a result of these cuts.
Great, thank you, Bill. I want to shift over so slightly. We think about the Catholic community, and this is one of the reasons we invited all of you to be a part of this. Why does the Catholic community partner with the government? I mean, you've given us a little bit of a lens into that not all the funding for CRS comes from the government, but how is this a work of faith? Can the financial contributions of Catholics and others make up for these cuts?
That is such a great question, and a really, I think, important one at this point in time. First of all, the assistance from the government helps us and other elements of the church to do our mission. The assistance that CRS provided to Sister Annalise to help children, orphans from HIV, that is the mission of Sister Annalise. That is the mission of CRS. And so we are just able to get the support of the government to expand and grow our mission as the Catholic Church, and to do God's work and bring the gospel to people through action. And I think that that's the first thing. We're only doing things that we want to do. We're not doing things that they want us to do that we don't want to do. We're doing our mission, and they are a source of funding. Governments by far are the largest source of humanitarian and development assistance. We are very blessed with incredibly generous donors, probably many on this call, for which I thank you. But there is no way, particularly in these large emergencies and for these huge problems like HIV, that private donors are going to be able to step in a sustainable way. Only governments can mobilize the kinds of resources at the scale needed to address these situations. And I think that's really where the partnership is so important. We have, and I think the sisters on this call are just such fantastic examples, these creative, faith-filled, on-the-ground efforts that are then able to scale and grow because of government resources. And that's what's great about the partnership. You have the last mile reach of the church and the innovation of people like these sisters on the phone, on the call, with the resources of the government, and that's a very, very powerful combination. There are benefits to people, benefits to the church, and benefits, frankly, for propagating the Catholic vision of development. What does it mean to be a person in the world, and how we as a church are trying to create a world where people can thrive?
Thank you. Thank you so much for that. There's so much to go on, but I'm going to try to get us going and just opening up the conversation and asking questions that I'll come to all of you about if you want to answer. But we've talked a lot about the Catholic Church's role in all of this, but what do you guys think are the moral dimensions of the United States abandoning its commitment to the programs that you all work on, and other programs that we haven't mentioned but we know of, places like Sudan, places, and we haven't even talked about Asia, but we know that there is support for countries around the world, this global human family that we're a part of. But what are the moral dimensions to this abandonment, this change? Sister Annalise, you look like you wanted to say something, so please, let's hear from you.
What I wanted to say is common good is for everyone. And today, I just want to share with you what happened during COVID. This is my story. I was in the US when I heard about COVID. And I thought, I am far because it was in China. It was just 2 weeks. It was in San Antonio, where I was. The program that I was attending was closed. I was thinking of going back. I couldn't go. Today, we are talking about these challenges that will happen or they're happening in the continent. Okay? Especially on HIV and AIDS. People are moving. We can't control that. The more we raise the numbers of the new infections in the continent, the more we raise the numbers of new infections in the US. The more we control the challenges in the continent, we are going to handle most of the challenges that we're talking about today: economic issues, migration, peace and security, all those kind of things will be affected. As I'm talking, there are shipments that are going to the continent or wherever they are going to give support to the people. There are farmers here in the US who have grown crops and they want the market. Where are they going to sell this if there'll be no one to buy this, so that at least they can give people who are in refugee camps today? We're talking about Gaza. We are talking about Ethiopia. We are talking about DRC Congo today, South Sudan and Sudan, Cameroon. What will happen to those people? Will they stop eating? We don't know. So we have to think of the win-win situation. Who is going to lose? Who is going to gain?
Right. Bill, what are your thoughts on this question?
Yeah, thanks. I have a couple just quick thoughts. The first, in Catholic teaching, of course, each of us as individuals has a moral responsibility to reach out and care for our neighbor, and as Jesus defined our neighbor very broadly. And also in Catholic teaching, countries have responsibilities to other countries. And so Pope Paul VI in Popularum Progressio talks about the responsibilities of the wealthy countries to the less wealthy countries. And so sometimes I hear about, yeah, it's, of course, charity is good from people, but governments, it's a different story. From Catholic teaching, it actually isn't a different story. I mean, we can have reasoned discussions about how much and what kind and all that kind of thing, but it's in the end, it's not. It's the same responsibility. Second point is, there's a lot of discussion nowadays on balancing the debt. We do have a huge debt crisis in this country, but it's a moral issue, because if we balance the debt on the backs of the poorest people, the people with HIV around the world, that is frankly just profoundly immoral. And there are many more effective and better ways to deal with our debt crisis than pushing it off to rural Kenya, where innocent children and their mothers are trying to live their lives being faced with HIV. And finally, we are the most powerful and wealthy country in the world. And I sometimes wonder, what's the point of being powerful and wealthy if you don't use that power to help the more vulnerable? And if you don't use that wealth to be, do we want to be remembered as some dragon that sits on top of a pile of gold or something? And I hope that our country wants to be remembered, and we as people want to be remembered as the country that ended HIV through the PEPFAR program, that ends global hunger, and that attacks these serious problems that our brothers and sisters around the world share with us, and finds through our own innovation and partnership with others a way out. And I believe that we can do that, and I think it's a moral failing that we're stepping away from looking at the opportunity to solve these problems and instead kind of shrinking back into the shadows. So thanks.
And well, thank you, Bill. I mean, even as you talk about that, we realize that our faith teaches us that we're one human family. It helps me also think a question that came in is, how do we convince the political leaders in the US? And I think, how do we convince political leaders, but how also do we convince those who are either other Catholics in the pew or people of goodwill that this is important, that our support for vulnerable, marginalized people, particularly those outside the US, when we hear about the parable of the Good Samaritan, the question is who is the neighbor? Who is neighbor to the man on the fallen by the wayside of the road? But who is our neighbor, and how do we help people see that our neighbor is not just the person in the house next to us, but down the road? Dee, I'm thinking about turning to you because you're nodding. So what do you think?
I think one thing for me that's so important is behind every statistic is a person. It's a mother, or it's a child, it's a gay person, it's a straight person, it's a poor person, it's a rich person. And once a person receives their diagnosis that they're HIV positive, a whole process starts up. They have to accept that they're HIV positive. They're worried about how they're going to tell their families. They're worried if their neighbors are ever going to find out. They're worried if they're a pregnant woman and they're positive, they're worried that they're going to pass it on to the child. And what we see here all the time is that if you have enough people on the ground with compassion, these are people who are trained as what we call promotores de salud. They're health promoters in the rural areas. They have the basic knowledge of HIV. Almost everyone has had somebody or has somebody with HIV in their family. They know how to talk to these people. They don't ask for a big salary. They ask for just enough to cover their bus fares and maybe one meal a day as they move around the communities. These are the people who are being let go now. These are the people, the first to be let go of. We don't need you. And as infections increase, we're going to see youth with TB again. We're going to see more babies born with HIV. We're also going to see the men who are HIV positive who can't cope with the situation of unemployment and illness, and so they go back to the canteens and the bars and drink and drown their sorrows in what's going on. And I think for me, it's immoral as a faith-filled person, it's immoral for us to allow those situations to happen. And it doesn't take much to be compassionate. It just needs, I feel, the strength to say there is hope if we all get together. And I absolutely adore what Florence said, because I firmly believe we are a global community. We don't have boundaries. We don't have borders. We're all one community. And so whatever happens in Kenya touches me in Guatemala. Whatever happens in Guatemala touches somebody in Rwanda. And I think that that's so important for us. And I just think that if we, individuals, families, and communities are struggling at the best of times here in Guatemala to eat enough without the added burden of looking for services and medicines that are in short supply. And I think all our leaders need to hear that behind every statistic is the face of a person. And that is what should really touch us more than anything. So that's just what I wanted to say, that's all.
Thanks, Dee. I think we have time for one other question. And Sister Florence, I want to turn to you. I asked you about your faith and how that sustained you, but how do you think that we, and I'm saying us of all, everybody on this call, in this meeting, but how do religious/Catholic organizations, how do they serve those in need in a way that's different from secular or state-led programs? Why are Catholic organizations so successful at doing this work? I mean, you've all been doing it for so long, and you've been committed to it, but why do we look to our brothers and sisters in our Catholic Church who are doing this work so well?
Okay, well, one of the things is that as religious women, and for that matter, also religious men, in the Catholic Church, we have denied ourselves to our personal families. And therefore, whatever mission we get involved with, we do it wholeheartedly, without looking back. These people become my own children, my own sisters, my own brothers. And we give ourselves totally to these ministries because also of our convictions that you cannot claim to know God if you neglect those around you, because we believe everybody is created in God's image. And for that matter, I should see God through the eye of the other. So when people are suffering and dying and struggling with HIV, I should also be impacted by their pain. I got into this at a time when we were having a lot of stigma in this country. I happened to have studied in the US. By that time, they had overcome quite a lot. But here the stigma was so high. We were losing people, about 700 lives every day, to HIV/AIDS-related illnesses. And going to 30-person bedridden, struggling, encouraging that person and telling that person you are not alone is what gave a lot of people hope. Sister D has talked about how many of the workers have been laid off. In Kenya, we are talking of more than 40,000 people who were overnight laid off with a pronouncement, without a warning, no compensation, disregarding even their contracts. What are we going to see from this population? We are going to see a lot of mental illnesses, a lot of depressions. These are people who have families who were relying on the employment. And then overnight, you wake up one day, you slept yesterday with employment, knowing you'll have an income to pay your bills. You wake up as a pauper, because even no compensation for any contract that had been signed. You wake up and you are told, stop everything, drop the tools, get home. So it's a real ripple effect from those infected to those who have been serving them. We are likely to see people getting depressed and also becoming suicidal, unfortunately. And therefore, I agree with the words of Pope John Paul II. If you want peace, fight for justice.
Right.
For me, what is happening is unjust. And it can easily catch up with us sooner or later. The fight, the TB is going to be in the increase, in the rise. These people are not boundary bound. As Sister Elena said, Ernest said, they are traveling. We will move it from here to other countries, including US. Thank you.
Thank you, Sister Florence. And the time goes by so quickly. We've had other questions going on, but I have to end and we have very little time. So I want to ask you for one short final comment. So just a few seconds about how those who are watching, those who will watch this in the next couple of days, how should individuals, parishes, and members of the Catholic community respond to these proposed cuts and the abandonment of the U.S. commitment? How do we express our solidarity as believers and as citizens of the United States? How do we replace that fear with hope? Sister Endless, I'll come to you first.
Let us scan the environment and look at strategic partners that we can work with. And what kind of resources can we provide to make sure that we are preventing life? Yeah.
Thank you. Dee.
I think convince the people that we won't abandon them, that whatever is left for us, We will continue into the future with the little we have. And I would ask everybody just to look into their hearts and respond as they hear themselves.
Great, thank you. Sister Florence.
Yes, regardless of the situation, we are going to be there for the suffering. I would just urge people of goodwill to look at these vulnerable people. And I know besides the government, there are people of goodwill who might be even listening. Whatever you can save and send to save a child, either through CRS or through our organizations, please do so. The situation is not very good, but we need to give people hope. We can't afford to lose hope. This is a Jubilee year, focusing on hope. We are holding on hope. Christ is our hope.
Right, thanks for a reminder about the Jubilee year. And Bill, I come to you. How should we respond and express our solidarity concretely?
First, amen, Sister Florence. Thank you for that message. Just two quick things. First, I think prayer, praying for our country, that those whose hearts have hardened might be softened. And second, I really do encourage people to advocate. These cuts are made on a premise that the American people don't care. And I think we as the American people have to show them that we do. And so if you go to crs.org, we have a action alert. We've had over 100,000 responses so far. We're trying to flood every office of Congress, Republicans and Democrats, so that they really understand how we as Catholics consider caring for our brothers and sisters around the world a critical moral responsibility. And we can definitely turn the tide on this, but it's going to take hard work and action, and I certainly invite everybody to lean into it.
Thank you. Thank you, Sister Annalise, Dee, Sister Florence, and Bill. Thank you for just joining us for this timely, urgent conversation. And you all make me very proud to be a Catholic. So thank you, thank you, thank you. Just a reminder to everyone who's listening today that this discussion will be recorded and posted on all of our website and social media channels. And we have follow-up resources from this discussion posted on our website as well. I mentioned earlier, but I hope you can join us next week, Wednesday, March 19th, for a Dahlgren Dialogue in partnership with Georgetown's Office of Mission and Ministry on the Francis Factor, the leadership of the world's pastor. As we continue, we will be praying for our Holy Father and examine his impact in the world. Our participants will be Blaine Bayan, Georgetown student, Cardinal Sean O'Malley, Anna Rollins, Inez San Martin, and Chris White. Please visit our website for more details on this gathering. Once again, I want to thank my colleagues, Kim Daniels, John Carr, Anna Gordon, Christian Sunan, and our student fellows, Kiera Farrell and Vero Irby Kessler, for their help in putting all this together and making sure that I look like I know what I'm doing. And finally, please join me again in thanking Sister Annalise Chambly, Sister Florence Maria, Bill O'Keefe, and Sister Dee Smith for being a part of this public dialogue on human cost of abandoning U.S. help around the world, the experience of Catholic sisters, and of course, our colleagues at Catholic Relief Services. Thank you, and we'll see you at our next dialogue.